We're going to go over some hip glute release techniques for prenatal. We have our client here. Her name is anonymous today, and normally I don't cover their faces, but it's a little bright in here, and this way no one sees who she is. So a lot of prenatals have issues with their hips, and a lot of therapists don't get, they're worried to get too deep or, and stuff like that. You just communicate with your client and you should be fine. Build that relationship up through their prenatal sessions and you'll see how much they can handle. So she's complaining about her glute. It hurts right in the middle, right? That's what you're saying? Okay. She's gonna point. So right around the SI joint, you got, all through the bone through here, a lot of nerves run through that area, so you got your SI joint issues. The ligaments starting to get stretched from the belly growing, and we also got the piriformis, sciatic nerve, all that running down the leg can cause some issues. So let's get started. If you don't mind, please subscribe to the channel. That'll help us out as a small business. And if you have any comments, concerns, or anything, or just want to say great video, that works too. Just comment below. All right, so a lot of times I have the prenatal pillow that allows them to lay face down. This one we're going to do a sideline technique, so I'd like to do a little bit of active release. And she's probably like, what, you're going to make me do something? But first things first, I like to do, when I do any prenatals, I like, she's already given permission to move her underwear and all that stuff, so, I think it's really important to get the inflammation away from the SI joint. So I like to push away. Is that a little tender?
Nope, feels good.
It feels good, see. In general, and normally my table height's a lot higher, but this, for the sake of this video, we were doing it pretty quick, so I didn't raise it. But I like to put, like I said, push a lot of that tension away from the SI joint and do it all the way down. If you have lower back pain and you get worked on, you usually know what I mean by it really feels good when they get through here and start just pushing away all the way through right next to the bone. I like to use a fist, some knuckles. Yeah, it can be a little tender, but it also feels pretty good. How's that feeling to you?
Good.
One also thing with sidelying that I really like is it gives better access to the QL muscle, Quadratus Lumborum. A lot of people have issues with lower back pain, have that issue. So I'll show you a technique in a minute after we warm it up a little bit, getting the blood flowing. All right. What I like to do is I like to put my forearm and line it up right next to the bone. So alongside, I'll stand up so I can get a little bit of leverage. And how's that pressure? Too much? You want more or less?
Oh, it's good.
Okay. Does that feel like it's an area that's bugging you?
Mm-hmm.
Okay. She's going to really notice it when we get into the piriformis area. She's like, I don't know how I feel about that. Okay, now we're going to drop a little bit lower. I'm using the blade of my ulna rather than just straight elbow. A lot of, at least my prenatal clients, one complaint they have with certain massage therapists is the therapist seems to be afraid to get enough pressure. It's like they're fragile or something. As long as you wash it out really good, push the blood flow through, you're pretty good with doing trigger point. Now, I'm also going to do an active release too in a minute. How are we doing? I think she feels it.
Mm-hmm.
Is that shooting down or is that okay?
Yes, it is. It's fine.
Okay.
I feel like I need it that way.
Yep. So what I like to do, as you'll see, is right around here. If you want to see where I'm at, I'm kind of right here in the glute. I'm going to lean down into it. And then I'm going to have them actually bring their knee up towards the ceiling. And relax it. There you go. Now, I wouldn't maybe do this on the first time prenatal, like the first time you see them. Maybe, work your way into that, the sessions to see what they can tolerate, how their body responds. She's gotten a few of them. That's the benefit of working at a massage therapy place. So bring her, do it again. So what we're doing is go down, is getting right on that trigger point, and having them activate that muscle. Sometimes it's also a way to point out to clients that they need to strengthen their glutes. She's like, "Are you talking about me?" Mm-hmm. Good. All right. And I would, do this on both sides, but typically our right glute tends to be a little bit weaker than our left one. So we want to, and then you get a lot of pelvis issues with if it rotates anteriorly on the right side. So working all this area. Does that feel a little looser than it did when we started? Mm-hmm. She's like, for the sake of the video, I'm going to say yes. But no, it really does. I can feel a little bit more movement. Remember, right now I'm kind of pushing the blood flow through. Use your palm if you want. Make sure, especially if you're a female therapist, make sure you lunge into stuff. Use your legs. Don't try to manhandle it with your arms. I mean, those are your money makers. We don't want to injure them. All right, next we're going to do is I'm going to hit on their QL. So you'll see the hip lines right here, that bone. You can kind of work along it like this. It can be pretty tender for some people, so just watch out. How's that feel to you?
Good.
Okay. In general, I mean,
Maybe it's a little tender.
Okay. Now that you say that. Now, for someone who's not pregnant, she's 25 weeks, but for someone that's not, I like to really get a forearm right in here and just kind of sink into it and have them just take deep breaths. You can check out one of my other videos for some lower back and hip techniques. Shame on me, I don't know. I don't remember which one that title was for that one. So, and like I said, we're always come back to that sacral area, push all the tension away. All right, and then what I like to do, you may have seen one of our videos. It's a stretching technique for the prenatal. So what I want to do is grab their top leg, which is the right leg, and I'm going to sit behind them right where their SI joint is, and I'm going to grab right here, and I'm going to pull backwards, and she's going to tell me right when she feels it.
Where should I feel it?
Right in your quad and your hip flexor. What I don't want is I don't want them to feel it in their lower abdomen.
Okay.
Okay. Kind of feel good?
Mm-hmm. Stretch.
Yeah. And you can actually resist that. So push towards, there you go. She's going to push kind of away from me towards her face. So, and then, so what I do is I get them as far as I can this way, and then I start to bend the knee. If they have knee issues, don't, just go slowly and make sure you don't hurt them. And lastly, actually I'll show you a really cool move, but you want to make sure to, like I said, build your relationship up, make sure the client is always comfortable, talk to them, make sure they know what you're going to do. In general, if for a pregnancy client, if they're hurting, they're usually pretty comfortable with you working, what needs to be worked on. Just make sure you communicate. So I like to get to the IT band and quads in this position. I don't want to dig on the IT band, obviously, but some of them will get knee issues. So you can kind of go across the IT band. What I like to do is don't dig onto it, but once you get past the IT band, just sink in. Sink in. Depending on the client, and then, like I said, we always need to communicate how far they're okay with you going up, just kind of working that out like that. Does that feel pretty good? Benefit of working at a massage therapy place, you get massages. And stay tuned. I'm going to show you all a really cool technique in a minute right after this one. Not that they're all cool techniques, but one I recently learned for how to work on the groin on a sideline position. So, and don't be afraid to, like I said, if you communicate well, work all the way up into the front of the hip flexor. They get a lot of issues in there.
Got a lot of weight up front.
There's a lot of weight up front. Can you see how I'm doing it, Brittany? If you need to, you can come over here. Brittany's our camera lady. She's getting better and better each video. Another way I like to do is you can use your forearm all through here, go across. Just be careful when you do it. Use some leverage if you want. You can hold their foot so they don't run away. I always say there's a good pain and there's a back off pain. If it's ever too much, just say something. Try to get all the way up into there. And there's a lot of upper body and neck and all that, those good techniques for prenatal sidelying as well, but we're focusing mainly on lower half. She might be lopsided after this though, because I'm only working her right leg. All right, like I said, there's a way to actually work the left side and the groin. Now I'm going to show you on the right. It's going to have to be on the other leg because that's the only way to get to it. But what you do. And actually, it is important to get both sides because if your right leg tends to be your action leg, so you tend to put more weight on your left one. So you're going to get a lot of tension on that left side. But here's how you do it. So if you want to come on this side, Brittany, you tuck the sheet like this. Now, and like I said, maybe not the first time you work on them to do this, but build the relationship up. Offer, these are certain techniques I can do, and make sure they're comfortable. But what I like to do, you get right here to the groin. Some of this, you're kind of flying blind, so you don't want to go too far up or anything, but still it's good technique to get to the groin. You can even use, I like going across the muscle, cross fiber. Helps release it real good. Does that feel good? Tickle? Hands are cold. Normally, no, I make sure they're a little bit warmer. She'll say that, no, he doesn't. But, it is December right now, or January right now. Kind of working it like that, and then you can kind of get your forearm and go across. Good. How's that feel?
Good. It's ticklish.
Not as ticklish with the forearm. Anytime you have a client that is ticklish, use a broader area, maybe your fist or your forearm, or even if you're hitting a target area with your finger, put your hand over it so that they're not as ticklish. All right. Now the QL one I talked about earlier, I will attempt on her, but I'm not going to do it as deep as I would if it were a client that was not pregnant. But basically you would put your ulnar blade like this through their hip and just kind of sink down and in. How's that feel?
Good.
Okay. because a lot of times with their right side specifically, they tend to hike their hip up a little bit higher, you know, so we want to have them take deep breaths, and this will help release that. I actually had one client recently that said, as I was telling her to take deep breaths, she goes, "No, I'm not dumb. If I take a deep breath, you go deeper." It was really funny. So, all right, yeah. If you don't mind, thanks for watching this, and I hope you have lasted this long. I hope you know, if you would subscribe, that really helps our business. Comment, you know. You can always follow us on Instagram. If you're in the Atascocita, Texas area and you'd like to try out one of our massages, or, you know, we have a team of great massage therapists that can take care of you. All right, and please like this video as well. I hope you have a great day, and thank you for watching.